Hi, I'm Dr. Cath Watson, and PD Insurance has asked me today to take you through what a veterinarian would examine in your dog during our consult, so you know what we're doing, because we don't always talk about it. So I've got my lovely assistant here, Sadie. Good girl. Here we go. How's that? So Sadie's a lovely, healthy dog, but we're going to take you through all the way from the nose to the tail, what we look at when we're doing a health check on your dog, so that we're making sure everything is looking pretty good and healthy. Actually, it starts when they first come in the room. So we're looking at how they're moving, what they look like, what's their weight like, what's their behaviour like, because obviously some dogs love to come in, and Sadie's a pretty happy, friendly dog, but not all dogs are. Some dogs are really worried about coming into the consult room and are quite anxious. So sometimes your vet might actually just spend a bit of time talking to you, and you can let the dog have a wander around the room and just feel a little bit more comfortable about how things are going. Like I say, Sadie's a lovely patient here for us today who's very friendly and very comfortable being here. So I'm just going to get started on what we'll be looking at when I'm examining her for a health check. So first thing, nose. She's got this beautiful nose here, nice and clear, no discharges coming from the nares here, the little holes where she breathes. It's a nice and wet nose. The temperature of the nose, it tends to reflect more what the environmental temperature is rather than anything particularly wrong with her. So her nose is looking really good. So then we move on to the eyes. So again, you can see Sadie's eyes are nice and open and clear, and there's no discharges, there's no staining of the fur running down from the corners of her eyes here. There's no lumps or bumps anywhere there, so nothing I'm worried about there. Again, her ears, she's got these beautiful clean ears, so we look on the outside but also the inside of the ears. So we're going to turn her head sideways? Yes, we are. Here we go, like this. So you can see in the side of her ear there, I'm looking inside that canal, and I can see that it's all looking, there's maybe just a tiny bit of wax there, but it's looking nice and clean. It's not looking inflamed at all. It doesn't smell bad. So we don't just look at one ear, we look at both ears, because it's really common for dogs to have a problem with just one ear. So we're going to have a look at your other ear, Sadie. Beautiful, nice and clean as well. Alright, so the next thing we're going to have a look at is the mouth and the teeth. So first thing we want to do is have a look at the lips. So we're going to lift it up, try and turn you sideways, and we can see the teeth, and we're going to look all the way back to these teeth right at the back of her mouth there. So you can see just a tiny bit of tartar on the teeth at the back here, and then we're going to have a look right along the ones up the front, right round the front, and then I'm going to look on this other side as well, but I'm not going to make Sadie turn around. And then the next thing I'm going to do is open her mouth and have a look right inside, so I can have a look at her tongue, and I can have a look in the teeth inside the mouth as well. Then we're going to have a look under the neck, and under here are some lymph nodes. This is what we refer to in humans as glands, so often feel those in our necks as well. So those are organs that often end up a bit enlarged whenever there's inflammation around. So we're checking there, so there's some under the neck, some in front of the shoulders here, sometimes we'll feel some in the armpits, in the groin, and then right in the back of the legs. Thank you, lovely kisses. Alright, so working your way down, having a feel through the skin, any lumps and bumps. We're going to work our way down each leg, so having a feel for lumps and bumps. Thanks, Sadie. And then we're going to pick up the foot and have a look at the toes and in between the toe pads. And we're looking for inflammation of the skin in places like that. So down both legs, underneath, running hands under the chest, over the chest, and then we're going to have a feel of the abdomen. So this is, I call it a tummy massage, but at the end of the day we're actually having a feel of the organs inside the tummy. And working from front to back, so I've got the liver and the spleen at the front, stomach's in there as well, moving up to the kidneys, and then as we slide back, we're sliding through the intestines, all the way back to the bladder, and the colon to a point as well, so depending if they've been to the toilet recently, we may or may not feel some poo there. Yeah, not from you, hey? Alright, Sadie, stand up again for me. Here we go. Hey, no, what are we doing? So we've done the front legs, they're also going to do the back legs, have a feel, check feet. If there's any reports of lameness or the client thinks there might be a problem with the way the dog's moving. Then we might progress on to checking how the joints are working. So that's usually involving some movement of the joints, making them stretch out, seeing if there's any pain anywhere. We'll check the back at the same time. But often in a healthy animal exam, we won't necessarily be doing major tests on joints. So looking at the tail, looking for lumps and bumps on that. And then once we're finished with the tail, then we have a look under the tail. I know, yes, we're looking at bottoms. That's rude, isn't it? Hey? So under there we're looking at the anus, which is obviously where all the waste products come out. And in a female dog, we're going to be looking at the vulva. And in a male dog, we're looking. Alright, so once we've got to the back end, the exam is almost over, but the one thing we haven't done is had a listen to Sadie's chest. So for that I'm going to use a stethoscope. This cool apparatus lets us actually have a listen to what's going on inside the chest, so I'm going to be listening to the heart as well as the lungs, and in some cases we might even have a wee listen up at the throat and just see what's happening with the airways up there. Hey! Alright, so we're going to put stethoscope in my ears. Now, two things I'm going to do here. One's put the stethoscope on the chest and have a listen to the heart, and at the same time I'm going to slide my hand back inside her thigh, and we're just having a feel of her pulse at the same time to make sure that her heart is actually beating at the same time as she's actually pumping blood around her body. And because there's different parts of the heart, I'm going to listen on different sides of her chest, and then after the heart I'm going to have a listen to her lungs, and I'll listen over several areas of her chest as well. So as part of that physical exam, we've had a look all over Sadie, as much as we can on the outside, and then we've had a feel and a listen to what we can on the inside. And that gives us a pretty good starting point looking for whether Sadie's healthy. Yes, you think? And if there's any issues that perhaps we need to look into. Thanks for your contribution, Sadie.